This is John Geaver from MedPage Today. No genetic cause has been found for about 90% of cases of amyotrophic lateral sclerosis, or ALS. Almost inevitably, that has led to suspicion that exposure to chemicals may play a role. Some studies in particular have suggested that agricultural chemicals such as pesticides can increase the risk of ALS. A group at Harvard School of Public Health under Dr. Marc Weisskopf had the opportunity to examine potential links between chemicals and ALS in a large and unique group of individuals.
So that's what we set out to do, really, to look at the association between chemical exposures, particularly pesticides and herbicides, and risk of ALS in a very large, prospectively followed cohort study. And to do that, we took advantage of the collaboration we've had for several years now with the American Cancer Society. They have a cohort called the Cancer Prevention Study 2 that they formed in 1982 of over 1 million people, both men and women, from all around the U.S., every state, and Puerto Rico. And they've been following that cohort for death by linkage with the National Death Index since that was started. So we have been looking at that cohort for ALS deaths and have followed it now through 2004.
When the study began in 1982, the participants were asked about their past exposure to all kinds of chemicals and toxins. Dr. Weisskopf's group looked at death records from 1989 to 2004 for those attributed to ALS. They found more than 1,100, enough to see even modest-sized contributions from chemicals such as pesticides, if indeed there were any.
So we looked at this entire cohort for the rate of ALS by exposure to any of these different chemical classes. And in fact, when we did that, we did not see much increased rate of ALS among people who said they were exposed to pesticides, herbicides. And we really did not see much with any of the other chemical classes except formaldehyde exposure. People who reported that they were exposed to formaldehyde exposure, we found were at a 34% increased risk of ALS, or at a 34% higher rate of ALS. And what was particularly striking is that if we then broke out that exposure by how long they reported being exposed, there was a very strong dose-response relationship. So compared to people who said they were not exposed to formaldehyde, those who said they were exposed for less than 4 years were at a 50% higher rate of ALS. Those who said they were exposed between 4 and 10 years were at a 110% higher rate of ALS. And those who said they'd been exposed to formaldehyde for more than 10 years had a slightly more than 4 times higher rate of ALS. And that trend with increasing years of exposure was highly significant with a p-value of 0.0004. Taking that, we then looked at who was saying they were exposed to formaldehyde. In the overall cohort of this group, only 2.6% of people reported that they were exposed to formaldehyde. But if we looked by occupational category, these people reported what their major jobs were during their lives. There were basically 8 jobs that had a much higher percentage of people reporting that they were exposed. I may as well listen to it. They were beauticians, pharmacists, morticians, and chemists, radio or lab technicians, doctors and vets, dentists, firemen, photographers and printers, and nurses. All other occupations had below 4% of that occupation saying they were exposed. All of these were way above that. Beauticians, 25% of them had reported they were exposed to formaldehyde. If we then grouped all those high formaldehyde exposure jobs and compared them to people who were in any other kind of job, those folks were at a 30% increased rate of ALS, and that was significant at a p-value of 0.02.
I'm John Geaver, MedPage Today.